On December 31st, 2019, health authorities in Wuhan, China, told the World Health Organization they were treating about 40 cases of mysterious pneumonia. On January 7th, officials identified it as a new type of coronavirus, which they named 2019 novel coronavirus, now known as COVID-19. In the subsequent month, the first death as a result of the new virus was recorded, and it started to spread to other countries. Within weeks, South Korea, Iran, US, and parts of Europe were reporting thousands infected, and thousands were dying. COVID-19 became a global pandemic. It was only a matter of time before it reached our shores. We now stand at 1,655 confirmed cases, and we are currently in a lockdown. It has been about a month since we confirmed our first COVID-19 case. Let's take a look at the events that led up to where we are now. On March 3rd, a 38-year-old man in KwaZulu-Natal reported symptoms of coronavirus to his private doctor. He isolated himself, and so did his doctor. 2 days later, on March 5th, Health Minister Zweli Mkhize confirmed that the man was indeed the first person in South Africa confirmed to have the coronavirus.
This is an individual who had come from Italy and came through our borders when he had no symptoms and there was no problem whatsoever. And the symptoms developed about 3 days after his return.
The KZN man was part of a group of 8 who'd been on a tour of Italy. At the time, Italy's confirmed infections stood at 3,858 cases. The number of confirmed positive cases were slowly increasing, but the patients were from the same travel group from Italy. By March 11, the cases rose to 13, and the virus was no longer confined to the same travel group. Still, most of the new cases were what medical professionals call imported, traceable to travelers who arrived from other European countries. March 11th was the day WHO declared COVID-19 a pandemic.
But COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly.
The number of infected globally was now rising rapidly, as were the number of deaths. By this stage, South Africa had confirmed cases in Gauteng, the Western Cape, and in Mpumalanga. COVID-19 had begun its march across the nation. Wuhan, China was the epicenter of COVID-19, and the government quickly locked down the massive city. Caught up in the lockdown were scores of South African citizens living and working there. They just wanted to come home. South Africa's president instructed the SANDF to lead an operation to repatriate 122 South Africans and have them quarantined at the Ranch Resort, one of the Protea hotels in Polokwane, Limpopo. They would be quarantined for 21 days. 114 South Africans arrived at Polokwane International Airport from China. All tested negative for the coronavirus. By this stage, on 14 March, there were 38 confirmed cases of coronavirus in the country. One of them was a 14-year-old girl from Western Cape, the country's first patient under 18.
We have now declared a national state of disaster in terms of the Disaster Management Act.
On 15 March, the President declared a national state of disaster. That meant the closure of land borders and seaports, limitation on gatherings, and boosted measures in the healthcare system to curb the impact of the virus and more. During his announcement, President Ramaphosa also announced that the spread was no longer just from travelers, but from local transmissions. As the situation became more serious, business and civil society started to respond to the president's announcement with measures. Major churches agreed to cancel annual Easter gatherings and abide by the 100-people gatherings limit. Some churches even started to live stream to their congregations to promote social distancing. The taxi industry introduced hygiene programs at major taxi ranks. The term "flatten the curve" became common, and South Africans, where they could, made an effort to distance themselves from each other. But in the midst of all this, it was clear that South Africans were starting to worry, as many rushed to stock up on supplies. Government stepped in, gazetting price controls on essential items and promising price gougers would be punished. Government also showed how significant the consequences would be if people refused quarantine when a family did not consent to it after testing positive for COVID-19. The South Gauteng High Court ordered the family, including the father who refused to take the test, to be quarantined. Within 2 weeks, the country's number of COVID-19 cases reached more than 100.
In terms of scientists' estimation in the projections that they show, they indicate that the nature of the viral infection is that it will ultimately can affect up to 60% of the population.
After 15 days, the first 2 recoveries from the virus were announced. But unfortunately, the rate of recovery did not affect the spread of the virus. The curve of the growth was getting steeper by the day. On Sunday, 22 March, the president was in deliberation with business heads and the National Command Council. He was meant to address the nation.
The meeting is still continuing. There are very weighty matters before the National Command Council.
Rumors that a lockdown was on the table were rife, but any decision to essentially stop all activity in the country has serious consequences. Comparing the spread of COVID-19 in other countries with that of South Africa, it was clear we were reaching a crucial time in the progress of the spread of the virus. It was a Solomon's choice. Announcing a lockdown would significantly help constrain the spread, but its implications for the economy and South African citizens would be drastic. Government had to consider the risks of lockdown exacerbating our current issues.
The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
At this stage, all 9 provinces had a recorded case, and the president announced a national lockdown. As the hours and days to the lockdown ticked down, it became clear the decision would fundamentally change the way South Africa functioned. In the following days, mass preparations began. Enormous queues snaked out of shopping malls and local grocery stores as people panic bought and stockpiled essentials for the lockdown. Government kept assuring everyone that food and other essential supplies would not run out. Relief measures were announced to help small businesses and to keep the economy afloat. The private sector came in to assist with funding some of those measures. On the eve of lockdown, the president deployed SANDF and SAPS members to enforce the regulations.
Our country has never been through a period like this. This is unprecedented. To go out and wage war against an invisible enemy, coronavirus.
After the clock struck midnight, members of SAPS and SANDF descended and arrested a number of people defying the lockdown.
Get out!
But for the most part, citizens heeded the call and stayed home. And by the morning, most of South Africa looked like a ghost town. But in some of the nation's townships, life carried on as normal, as residents could only afford to buy groceries then, and most essential workers used public transport. Implementing the lockdown across the country was proving to be difficult due to the reality of life for the majority of the population: poverty, high-density living, and a relative lack of access to basic services. In the township of Zandspruit, residents have been protesting for service delivery for years, and as the lockdown began, they felt abandoned.
Even if it can come, we will all die. No one will care. We are the forgotten people. We are the forgotten.
Provisions were made for the homeless, but uncertainty was still felt by some of them.
We guys outside are homeless are more at risk for that virus, being in a crowd like this.
ACDP leader Kenneth Meshwe and his MP Steve Swart had been tested positive for COVID-19. Evangelist Pastor Angus Buchan had also been confirmed positive. All three were at a church event by the Divine Restoration Ministries in Bloemfontein, where 480 people were in attendance. The source of the virus was traced to 5 people who came from the US, Israel, and France, all tested positive. On day 1 of the lockdown, the reality of COVID-19 hit home, as we recorded the first death as a result of the virus, a 48-year-old Western Cape woman. On the second day of lockdown, South Africa was downgraded by Moody's to junk status. This meant that we had lost our last investment grade rating. Coronavirus reached the townships as Khayelitsha confirmed its first COVID-19 infection, and the second death was announced, a 74-year-old man. On the brighter side, the 114 South Africans repatriated from Wuhan were allowed to return to their homes and families after quarantine.
We are now able to declare the ranch a green zone.
We are happy that you have all been cleared of coronavirus. There is no coronavirus.
The early days of lockdown still saw crowds in public, albeit in an orderly fashion. SASSA beneficiaries were given early access to their social grants. Reports began to emerge about what appeared to be heavy-handedness by members of the police and the SANDF. A man in Vosloorus was shot dead during a lockdown patrol on Sunday. He was shot in his front yard, but had reportedly been drinking at a tavern, something prohibited under the lockdown regulations. Scenes from the previous days of the lockdown also added to the question of whether the actions to ensure lockdown by the SANDF and SAPS were too violent and brutal. In more alarming news, the virus had also extended into other townships. A man who was confirmed positive from Alexandra, who, pending the test results, left Gauteng against instructions and went to Limpopo.
It is now 4 days since our country went into a nationwide lockdown for the first time in the history of our democracy. We have never experienced a situation like this before, and a number of mistakes will be made in the course of all this. But we ask for our people's understanding that all this is being done for the good of everyone. We will continue to correct the mistakes wherever they are made. I have no doubt whatsoever that we will overcome.
The number of infected cases reported had reached a consistent growth in the country. Gauteng, KwaZulu-Natal, and the Western Cape had the highest counts. But Gauteng had become South Africa's epicenter of COVID-19. The deaths had risen to 5. One of them was renowned South African scientist Gita Ramji.
Today we want to report that the total number of patients of positive tests was 1,380, which is an increase of 27 cases from yesterday's announcement.
On the 1st of April, the health minister gave an evaluation on the spread of the virus in South Africa.
We've seen a slower increase of COVID-19 positive cases in the past few days, and I'm sure all of you have been noticing that.
The minister ascribed the reduction in the rate of increase to the closure of borders, quarantining, and the lockdown. However, it did not mean we were out of the woods, and maintained that we need to remain alert.
Internal transmission has started, and it may have a tendency to spread silently, as people with less means and slight symptoms may be slow to seek medical help as they are few and far apart.
Another issue was that the testing criteria of patients with symptoms is reactive and restrictive. This was not showing the true picture of the size of the problem.
We need to test hundreds of thousands of the population to get a better picture to refine our containment strategy. That's why I say even though we're talking about 47,000 tests, that's still far too low.
Previously, government was only testing patients with symptoms. The new phase is an offensive strategy.
We may be currently experiencing the calm before a heavy and devastating storm. We may need to be aware that there may not be many further warnings before the pounding descends. So there will be no time to prepare what we have not already put in place. Particularly in the next 7 days, we need every plan to be put in place.
Additional measures were now being implemented to curb the spread of the virus. Mass screening and testing across the country started to take place at identified red zones, even for those that were asymptomatic.
We will also be seeking reinforcements from some of the countries that might be able to assist. For example, we've approached the presidency to approach China and Cuba to actually assist with reinforcements.
Cell phone numbers can now also be used to trace people who are infected. This would help speed up the process of contact tracing and to see who was around the infected individual. COVID-19 has now infected more than 1 million people globally. This is 4 months after it surfaced in Wuhan, China. The rules of lockdown were starting to manifest a few obstructions for the country. In reaction, during the first week of lockdown, government revised and relaxed a few regulations to help the country function better. Some of the revisions were that people may cross provincial borders for funerals, but only close relatives could attend. Foreign nationals would also be permitted to be repatriated to their home country, and South Africans stranded overseas could come home. Taxi loading capacity was allowed at 70% of the vehicle's loading capacity. This would cater for essential workers using public transport. COVID-19 cases linked to Netcare St. Augustine's Hospital in KwaZulu-Natal were confirmed. 3 patients whose deaths were caused by the virus were admitted to that hospital. Government made a plea to patients who were at the hospital from March 1, 2020 to date to contact the province's health department. In about a month, the spread of the coronavirus in South Africa went from 1 case to currently 1,655 cases, 95 recoveries, 11 deaths, 56,873 tested. Have we done enough?
I'm Dr. Jo Barnes. I'm an epidemiologist and a senior lecturer, now semi-retired, from the Department of Global Health at the University of Stellenbosch. In the beginning, when we had just become aware of the disease, then there were very, very few people tested. And from there onwards, slowly, as the disease spread, this is a resource-constrained country. So I'm wanting to warn about the data at this point in the outbreak, that the clinical needs for testing people are in direct contrast to your needs to analyze the data and where it's going. Right at this point, we have a dearth of test kits and test capacity, and that has always existed and will exist for quite some time, because we do not actually have hundreds of thousands of test kits available, and nor do we have the capacity to analyze that or to get an answer. Just to give you an example, the young woman from Khayelitsha that has recently tested positive had her test done on the 18th of March, and the result came out on the 28th, which is 10 days later. So you can imagine how many people she came into contact with over those 10 days, while nobody knew whether she had it or not. They come into contact with a large number of people that when they are seriously ill, they can't even remember who they actually even saw. So contact tracing becomes very difficult under those circumstances. My take-home message is, please do not think that these figures are a true reflection of what is really lurking, because the lightly affected and the asymptomatic people are not even on your graph at all, because the lightly affected were not selected to be tested. So we may have the tip of an iceberg sitting on a very large iceberg under the surface. In fact, highly probable. And so please do not take this as, oh, this is not really a big problem. And I can only reiterate the other point I wanted to make, and that is listening to the requirements and the rules save lives. But it is going to get worse. It is going to spread. There's no doubt about that. And there are going to be casualties. What we are trying to do, or what they are trying, I'm not in the government, what they're trying to do is to keep this as low and as slow as possible. But I have, in a long term, as an epidemiologist, also a prediction for you to say that I don't think the world will ever be the same again after this. This virus, it may mutate into a lighter form, and I don't know, but this virus is going to be added to the pool of seasonal flu viruses. It's not going to go away. Hopefully after a while its effect will water down and there will be some form of immunity. At the moment we know so little of it that we don't actually know whether the immunity is going to be lifelong. There are doubts that it may be, but even if you buy a number of years, it will bring this under control to the point where we can, while we are working on a vaccine. The final gold star answer would be, if we could develop a vaccine for it, then we will get this completely under control, but we need to buy the time.